All right, 6 months or so ago, I wrote an article in the newspaper, even though it's not a city council issue, that we were going to begin to lose doctors because of the situation at the hospital. At that time, it was 10% less operating time for the surgeons. We've already lost Dr. Tomler for 60% of the time to the US, and we're in danger of losing other doctors. The issues are beds, and there are more beds at the hospital, and there are more beds on the 4th floor of the hospital. There are beds that could be made available in long-term care facilities. However, the funding does not exist. And the reason the funding does not exist is because the LHIN has more, actually their focus is more on money rather than patient care. And as Councilor Rivette has said, the population is getting older, and we will need more long-term care beds. If the LHIN wants to do something positive, they want to look at how can they expand the long-term care beds in this city, how can they fund it, and continue to fund the hospital for what the needs are for the services that people need. Not funding because you want to put a budget in place. You can't guess how many people will need operations next year. You can't have a budget. It's like doing a corporate budget in a business as opposed to a city budget. You can budget corporately how much your costs are going to be, but in a city you can't do that because you don't know how much snow you're going to get, for an example. So you don't know what the costs are going to be. Hospitals should be run the same way. Should be funded based on what the needs are for the community. That's not being done.
I think as a board member of the Board of Health, I will have a meeting tomorrow morning, and I will bring my concerns to the Board of Health tomorrow morning to make sure they're well aware, and we have some LHIN people representing sits on the board that are concerns. I think you can't blame doctors saying they're moving, because if you don't have work where you are, you're going to move to another community. And this is the reason why we have to support the doctors and listen to their concerns, because we're spending around about $500,000 a year in recruiting of doctors. If we're going to recruit them and then we're going to lose them, there's a problem here. So the hospitals have to start working together, and I totally agree that this kind of stuff, but the LHIN has to understand if there's long-term care patients being taken up at the Hotel New Hospital, it's got to be dealt with, and it's got to be fixed so the doctors have the beds needed to do the surgeries.